All right, good morning. It is March 20th, 2020. I'm Jonathan Addington. This is your morning COVID-19 update. It's really based on information that we've been putting together internally at JM Addington for our own staff, and we've started sharing it so that everybody is able to plan better. U.S. cases today are up to about 14,300 from 9,000 yesterday morning and 11,800 yesterday afternoon. We're not going to stop repeating this part. Cases are going to keep going up until we get testing figured out. You're going to keep seeing them go up at an exponential rate. That means a sharp uptick. Looks like y equals x squared, if you remember that from middle school. And you got to remember that getting the testing out is more than just getting tests available. It means training workers to be able to safely test, getting tests to the laboratories that are actually performing them, and so on. So it's going to continue to take a few days to finish ramping up. When you see the increase in the number of cases, the question to be asking yourself is how are people going to react to this? The general public, businesses, your city, state, county government. The actual number of cases probably didn't have this massive percentage increase overnight. The number of known cases did. So how are your politicians going to react when they find out that the cases have increased in their jurisdiction? How are your businesses going to react when they find that out? Also, you can expect the number of deaths to start going up, and some of the headlines are going to look really dire. You got to remember that at this point we're prioritizing tests for people that are really sick or that have a high likelihood of exposure to COVID-19. Put another way, for every COVID-19 death in the United States right now, there's probably another 99 people that recovered, and a lot of those never even got tested. So as relatively more healthy people get tested for COVID-19, you'll be able to see the mortality rate start to drop. So again, just don't freak out as the initial headlines start coming in that are reporting more deaths. All right, so where are things going? We don't have a crystal ball, and we're not lawyers, so I can't tell you with certainty how your state, city, county government is going to react. I can talk a little bit about what other nations and states are doing or have done. Overnight, we saw Israel go into a nationwide shutdown. California is under a shelter-at-home order, and Pennsylvania has ordered all non-essential businesses to close. And this is really similar to what we've seen in other places like France and Hong Kong before, and Italy. Now, these are you're not allowed out of your house in general orders. There you can only go out to places like the grocery store, the bank, the pharmacy, places that you absolutely need to go to. That means that you're actually not allowed out to the bar, the beach, or the places that most people have already stopped going. We think that's important to note what other places are doing, just because it's the closest thing we've got to some guidance about what is likely to follow. Just having watched the news, it looks like the coasts in the U.S. are 2 or 3 weeks behind what Europe has been doing, and that the Midwest and Southeast United States are a few days to a couple weeks behind what the coasts are doing. Think Los Angeles, New York, San Francisco. Again, this isn't an absolute prediction. But it is some actual data that we've got to base our decisions on. It's not pure prognosticating. Our internal guidance at JM Addington every day this week has been assume that this is the last day that you can go out and prioritize accordingly. So glad that we've been wrong for 5 days in a row right now. The worst case scenario is that being wrong still means that we're ready. Everyone here still has toilet paper. Don't hate us. Something else that we're not going to stop repeating is follow the data-driven news. Most of the predictions in the headlines are entirely unhelpful. Everyone here is in uncharted waters, and we're really watching what the cases are doing, and to repeat myself again in this one video, how other places and people are reacting, because that's actual hard data on how things are unfolding, not just guesses and prognostication. Something to watch out of Italy. One little thing, there's one report that says that they think the coronavirus was there as early as November or December. We'll really have to wait and see if there are more reports that back that up. But if so, it would be really interesting, because it would mean that this was actually circulating as far away from Wuhan as Italy before we even knew it existed in Wuhan at all. Finally, if you look at our blog, you can see a chart of what the federal government considers essential critical infrastructure workers. If these updates are helpful to you, please let me know in the comments or like the post or something. And if there's a question you've got, feel free to ask it. If we feel like we've got internal expertise to answer it, we will. Otherwise, we won't. All right. We'll see you this afternoon. In the meantime, go forth and do good work.